As the ADA coordinator, knowing that I could be protected against COVID-19 was my #1 reason for taking the vaccine. Protecting myself, my family, and other persons to whom I provide services to is my priority. So I'm encouraging everyone, especially those with disabilities, to step up and take your best shot against COVID-19 and take the vaccine.
Greetings, my name is Wayne Biggs Jr., CEO of the Virgin Islands Economic Development Authority. We at the USVI EDA thank you for participating in Vision 2040. Your responses to the community, business and diaspora surveys and participation in the open houses and town halls provided the data to create the territory's first 20-year economic plan. The Virgin Islands Economic Development Authority will be presenting live the USVI's 20-year plan on Tuesday, March 30th from 12 p.m. to 1 p.m. Join us on radio, TV, and social media. For more information, visit www.usvi2040.com. Vision 2040, our community, our economy, our future, a vision of prosperity for all.
Good day. Welcome to the Government House Weekly Press Briefing and our COVID-19 update for the week of March 29th, 2021. For the benefit of the radio listening audience, I am Government House Communications Director Richard Mota. Joining me this afternoon is Dr. Esther Ellis on behalf of Health Commissioner Justo Encarnacion to provide the latest COVID-19 and vaccination numbers and information on where persons can receive free COVID-19 testing in the territory this weekend. We also have with us today Attorney Eric Chancellor, who is the Chief of the Criminal Division at the Virgin Islands Department of Justice on behalf of the Attorney General. But before we go to Dr. Ellis and our other guests, I want to take this opportunity on behalf of Governor Bryan to congratulate the community. 3 months into our vaccination strategy, and with 3 months left until the July 1st deadline of Governor Bryan's goal to have 50,000 people in the territory vaccinated against COVID-19, we are halfway there. This past weekend, the Virgin Islands Department of Health vaccinated the 25,000th person in the territory against COVID-19. And on behalf of Governor Bryan, I extend a heartfelt thanks to the entire team at the Department of Health, FITEMA, the Virgin Islands National Guard, our partners at the Department of Defense who are here in the territory assisting with our mission at our community vaccination centers, and all of our partnering health providers in the territory for their contributions to this important and life-saving effort. We are doing great as a community, in most instances continue to be ahead of most places in the nation in our response to COVID-19. But while we are doing good, we have not yet met community immunity. We still need to heed and do the common sense things to protect ourselves, our loved ones, and our community. We are still losing people to this virus, so it is necessary for us to do the things we need to do, like avoiding mass gatherings and practicing social distancing, continuing to wear your mask, and of course, washing your hands regularly. We can win this battle against COVID if we hold one head and keep fighting together. At this point, I'll turn over the briefing to Dr. Ellis for the COVID update from the Department of Health. Dr. Ellis.
Good afternoon, and thank you, Commissioner Encarnacion and Governor Bryan, for the opportunity to update everyone on our current COVID-19 data. As of March 27th, we have conducted a total of 70,342 tests with 2,907 positives. 6 new positives were reported on the 27th, and our 7-day percent positivity is down to 2.4%. We currently have 55 active cases in the territory, 26 on St. Croix, 20 on St. Thomas, and 9 on St. John. As of this morning, Juan F. Louis Hospital and Medical Center reports 5 COVID-19 cases with 1 vented, and Schneider Regional Medical Center reports 1 COVID-19 patient that is also vented. We have completed 4 weeks of vaccinations in the Community Vaccination Centers, or CVCs, on St. Croix and St. Thomas, and our second Saturday community vaccination on St. John. Since opening on March 1st, we have administered 9,845 total vaccines at the CVCs alone, and 25,105 people have received at least 1 vaccine dose. Last week, as a territory, the U.S. Virgin Islands crossed the 25,000 mark for individuals vaccinated for COVID-19. This achievement shows that the territory is on target to meet Governor Albert Bryan's goal of having half the population, or 50,000 people, vaccinated by July 1. As more individuals become vaccinated, the Virgin Islands community gets closer to reaching herd immunity and some sense of normalcy. On March 1st, community vaccination centers opened, and on March 20th on St. John. They opened March 1st on St. Croix and St. Thomas, and 20th on St. John. In just a little over 4 weeks, opening of these centers has proven to be a major success. Along with other healthcare providers, these options make vaccination accessible to everyone 16 and over. There is no residency requirement, and the vaccination centers are accessible to everyone. There are accommodations for seniors, individuals with disabilities, and those needing language translation. Homebound individuals can also get the vaccine, as the health department can accommodate their special circumstances. If you are interested in scheduling an appointment to get vaccinated, please call 340-777-8227, or you can schedule your own appointment online at covid19usvi.com/vaccines. Additionally, if you have an appointment, please keep it. Upcoming pop-up testing events this week: Tuesday, St. Thomas Home Depot, March 30th from 1 p.m. to 3 p.m. St. Croix Canagata Rec Center, Tuesday, March 30th from 10 a.m. to 1 p.m. Every time you travel into the USVI, you must upload a legitimate test result to the travel portal. Accepted tests are negative antigen or negative PCR within 72 hours of travel, and positive antibody within 4 months of travel. We have seen a recent uptick of fraudulent test results being submitted to the travel portal in order to be cleared to fly in. In the past week, 64 results were flagged with authenticity concerns, and many of those were confirmed to be altered or made-up test results. These are not legitimate test results, and therefore doing this puts others' health at risk. A reminder that you must plan your test when you plan your trip. Submission of fraudulent test results, altered test results from a prior testing, or altering test results in any way is fraudulent. If your trip is short and you have trouble getting tested each trip, the easiest way to get around that is to get vaccinated and test for antibodies shortly after completion of the vaccine series. A positive antibody test result no older than 4 months is a legitimate test result to travel into the U.S. Virgin Islands. Let's all continue to do the great job that we have done in mask wearing, distancing, and hand washing. And please schedule to get vaccinated. The quicker we can get the territory vaccinated, the quicker we can reach herd immunity. Thank you for your time, and thank you to the community for listening and for keeping all of your prevention measures and keeping us all safe. Thanks.
Thank you, Dr. Ellis. We recognize the challenge of our residents who travel to the mainland for short periods of time and getting the required COVID test to return to the territory. That is why Governor Bryan has been discouraging non-essential travel and why the Department of Health continue to encourage individuals to get vaccinated. That challenge, however, is not an excuse to forge or falsify the required test documents. The administration, in its charge of protecting the people of this community against the spread of this deadly virus, moving forward, will be prosecuting individuals for engaging in this behavior. Here today to announce the administration's actions moving forward to curtail this activity is Attorney Eric Chancellor, Chief of the Criminal Division at the Virgin Islands Department of Justice, on behalf of Attorney General Denise George. Attorney Chancellor.
Thank you. Our mission at the Attorney General's office is to keep our residents safe from crime. In these trying times of the COVID pandemic, we are all responsible for keeping each other safe from sickness. That is why it was particularly disturbing to find out that some Virgin Islanders, and primarily Virgin Islanders, are intentionally putting their fellow residents at risk of infection from a potentially deadly virus. We are the ones who should care most for each other. We are the ones who should be going out of our way to protect each other. There is simply no excuse for this behavior. And make no mistake about it, submitting false documents to the government of the Virgin Islands is criminal behavior. Falsifying test results for submission to the government of the Virgin Islands is criminal behavior. In accordance with this policy announcement, the Attorney General has directed that henceforth, anyone submitting forged documents or false test results through the travel screening portal will be prosecuted. We have identified 2 Virgin Islands statutes that are applicable. Section 843 of Title 14, entitled False and Fraudulent Statements upon the Government, makes it a crime for anyone in any matter within the jurisdiction of any agency of the government of the Virgin Islands to knowingly and willfully falsify, conceal, or cover up by any trick, scheme, or device a material fact, or to make any false or fraudulent statement or representation in such matters. Violators under Section 843 face a fine of up to $500 or imprisonment of up to 2 years, or both the fine and imprisonment. Section 795 of Title 14 of the Virgin Islands Code is also applicable. Section 795 relates to the filing of and recording of forged instruments. That statute criminalizes the procuring or offering of any false or fraudulent instrument to be filed or recorded in any public office within the Virgin Islands. Violators under Section 795 will face a fine of up to $1,000 and can be imprisoned for up to 5 years. These laws have been here from the time the travel screening portal were established. Indeed, they were here long before. Everyone knows that it is wrong to make misrepresentations in matters as serious as the COVID virus. Everyone knows that it is wrong to submit forged or fraudulent documents to the government. The purpose of this policy statement is to put those few who would do those wrongs on notice that their criminal behavior will not and cannot be excused any longer. We must keep each other safe. When we cannot do so on our own, the AG's office will step in to help ensure the safety of this community. Thank you.
Thank you, Attorney Chancellor. We have some good news for our residents who have been waiting on the Emergency Rental Assistance Program. The program officially opens today, Monday, March 29th. For more information on how to receive assistance under this program, visit www.vihfa.gov/ERAP. Again, that is vihfa.gov/ERAP. Or contact the Virgin Islands Housing Finance Authority at 340-772-4432 or 340-777-4432. The Department of Finance has paid out approximately 39,000 checks under the $600 CARES Act 2 stimulus program. There are about 3,000 checks currently being processed for payment next week. After those are issued, we anticipate approximately 3,000 more checks, primarily owed to individuals who have filed their 2019 income tax late, and those will be paid out by mid-April, ending the payout of the CARES Act 2 stimulus package. The Virgin Islands has not yet received the funding for the $1,400 stimulus payments under the American Rescue Plan from the U.S. Department of Treasury, but is prepared to move on those as soon as we receive that funding. As we bring in more federal resources, it frees up the local general fund resources to take care of local obligations such as income taxes. While we are looking at supplements to fill gaps in the government of the Virgin Islands' budget, Governor Bryan's priority is to pay the people first. We have issued 6,424 income tax refunds recently, totaling $15.7 million to Virgin Islands tax filers owed refunds for tax year 2018. And so I am sure that is welcome news to a lot of our tax filers who are owed refunds. The Bureau has established a hotline to assist in responding to the volume of calls due to the stimulus payments and refund check inquiries. That hotline number is area code 340, number 714-9325. Again, that is 340-714-9325. In closing today, we have an especially long Easter holiday weekend, beginning with Transfer Day on Wednesday and ending with Easter Monday. Government offices will be closed during this time, and Governor Bryan encourages all Virgin Islanders to enjoy the long holiday weekend, but to do so safely and in accordance with the local health guidelines. Please do enjoy the beach, but remember, they will be open at 6 a.m. and closed at 5 p.m. from this Wednesday until Monday. All other health guidelines apply while on the beach, including mass gathering restrictions and social distancing. Enjoy the beach this weekend with members of your immediate household. We also have some good news for our faith-based community. Governor Bryan has ordered churches in the territory in recognition of Holy Week and moving forward. He has eased restrictions on the seating capacities in places and houses of worship. The seating capacity now allows for up to 200 individuals or 50% of the capacity, whichever is less. Prior to this weekend, if you were a house of worship with a seating capacity of 300, you were limited to 100 parishioners, even though half your capacity was 150. Now you will be able to seat 200. Just to be clear, you cannot seat 200 if your capacity cannot accommodate 200. Again, moving forward, houses of worship are now allowed to seat half their capacity or up to 200 individuals, whichever is less. And of course, parishioners must wear their masks and adhere to all social distancing and other health guidelines. We will take any questions from the media if there are any. Okay, hearing none. Remember to wear your mask, practice social distancing, and get vaccinated. Have a great weekend. Enjoy your Holy Week and your Easter holiday weekend. Thank you.